Hello. Thank you for waiting for me. I'm so sorry that I kept you waiting. Had other patients, as well as I'm also coming back from a lunch break. You know. So, I see that you already completed your form. You completed your form, and I see that this is a follow-up from a cranial nerve that you had very recently. Okay, perfect. I just want to make sure that you know that the reason for your exam today is because you didn't do so well in the testing for the olfactory nerve, which involves your nose, and you also didn't do so well in the taste test. So we have you scheduled for basically that, as well as a allergy test, just to find out what exactly is going on. Okay. All right. So perfect. Okay. Just want to make sure we get everything down. Perfect. Okay. So before we do begin, I'm going to go ahead and just take your temperature, see if you're not feeling too great, if you're feeling a little warm, maybe a little cold. Gotcha. Perfect. Okay. All right. Everything seems good there. Why don't I go ahead and just get my gloves on? Let's go ahead and get these gloves on. Tell me, is there anything that you know in particular that you are allergic to? Okay. Okay, no worries. Well, listen, regardless of what we do here today, we do have some allergy medicine regardless. So you have nothing to fear. You can relax. We will take care of you here. So above all, I want you to feel relaxed, and I just want you to make sure that you're not nervous or anything of that sort, all right? Perfect. Everything's going to be okay. Okay. So today I'm going to just go ahead and begin by just going ahead and just taking a look at your skin. This involves from your face. This involves from your arms. Just checking to see how your skin is, seeing if it's oily, seeing if it's a little on the dry side, things of that sort, okay? As well as, I'll take a look at that, and we'll also be looking inside of your mouth as well. All right? Okay. So if you will, please go ahead and yeah, just stay perfectly still for me. Actually, if you don't mind, could you just move up a little bit? Yeah, just move up for me. Just like that. Oh, good. Good. A little bit more. There you go. Perfect. Okay, I think you're good right there. So, yeah, now just square up with me. Nope, you can put your hands down. Very good. Yep, perfect. Okay, so let me just go ahead and here we are. Just take a look at your skin. Good. Okay. Now, would you say that your skin gets dry? Okay, and do you by any chance drink plenty of water? Okay. Apply lotion to your skin for moisturizing? Okay, I see. And could you just lift your chin up for me? Okay. Very nice. Very good. Got it. during the change of the seasons as well, do you feel like you get a little extra stuffy? You can't breathe out of one of your noses, feel like you have to breathe out of your mouth, kind of thing? Okay. Alright. Perfect. Let me just, okay. Just want to make sure. Just gonna go ahead. Yeah, you can just stay still for me. Yep, you don't have to look at the light if you would like. You can close your eyes. Good. Okay. Okay. All right. All right. And let me just go ahead and take a look inside of your mouth, so if you will. Just give me 1 second. Just going to ask you to go ahead and open your mouth for me. This is nothing too scary. It's just so that I can get the light inside of your mouth. That's all. So, if you will please, all I need you to do is open your mouth. Good. And as well as stick your tongue out. Good. Okay. Good. About over here. Good. Good. Okay. Doesn't seem like anything out of the ordinary. Things seem okay in there. I'm actually going to place this right here instead. There we go. Okay, so now when I can actually begin, I feel like I have a better assessment of what you're looking like. So let's go ahead and begin with your nose. All right. So we're gonna use all of these. I actually have them pre-prepped just for you. So here's what we're gonna do. All you're gonna do is right now is you're gonna go ahead and cover your left nostril for me. Okay, very good. 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 And let's go ahead and have you smell this. And can you please tell me and identify this smell? Okay. Good. Good. That's a good one. Just as a warning, just so that you know, these colors don't reflect the flavor or the smell of what you're smelling. they're also not specific. They're also not specific to a particular smell. These are just a more or less. But as we progress with the examination today, the tests, we will have ones where you must specifically identify. Okay, so here's the next one. Here we are. Here's the next one. Okay, how did you feel about that one? Okay, good, good. And here is your next one. Here you are. Okay, what do you think about that one? Okay. Good, good, good. Okay. Here's your next one. Definitely the colors of these are very nice. Yeah, they are. Okay, how about that one? What did you think about that one? Okay, we're gonna go ahead and you're gonna go ahead now and you're gonna switch. You're gonna switch nostrils for me. And I'm just gonna go ahead and write down your results from those. Perfect. Okay. Also, don't forget that if you can't smell anything, you also have to let me know that as well. Okay, good. Okay, so here's your next one. What did you think about that one? Okay. Let's go ahead and just mix it a little bit. There we are. And here you are for the next one. Okay. And how was that one? Okay. Remember that if you cannot identify, if you can't identify what the smell is, you can also let me know whether the smell is a bit bitter, if the smell is a bit sweet, if it's somewhere in between as well. That also counts. Okay. This also applies for the taste test as well, once we get to it. Okay. Here we are. Okay. Here you go. And how do you feel about that one? Good. Good. Okay. So now I'm gonna go ahead and ask you to go ahead and you can use both nostrils now. And for the final three flavors, I'm going to need you to specifically identify the smell that you are smelling, okay? go ahead and start out with this one. Okay. Right. And here it is. Here you are. Now, can you identify the smell? Okay. Okay. You're correct, by the way. It is pinkberry bubblegum. Let's go ahead and write that one down. Perfect. And now, let's go ahead and get you this one. Here we go. Here's your next one. Just see if that helps you a little bit. And how do you feel about that one? Okay, I know this one was a bit tough one. It's okay. Just so you know, this one was flavored champagne cola, or the smell wise. Okay. And now for the very last one. The very last one, okay? Go ahead and mix it a little bit. Make sure you can correctly identify it. And here we go. All right. And how do you feel about that one? Hey, you got it right. Congratulations. I think that's the first time anyone's gotten this one. You're right. It is black licorice. There we go. Okay. Good going, by the way. Good going. Okay. So now we're going to go ahead and have you identify some flavors, alright? We're going to have you identify some flavors. So all I need you to do is let me know what you're tasting at any given time, okay? So if you will, please go ahead and stick your tongue out. Okay, and here's your first one. Here you go. And what was that one? Yes, all of these you must answer with the correct answer. Okay. That one was blueberry. Okay, it was blueberry. Good job. Okay, let's go ahead and get you the next one. Tell me, would you like an easy one or a hard one? Okay. Now, This one might be the hardest one that we have, but let's just go ahead and say that you asked for it. All right, so once again, I asked that you stick your tongue out for me. Good. And here you are. There we go. And what flavor do you think that one is? I will go ahead and say that you are incorrect. And I'm sorry about that one. I don't think anyone has ever gotten this one. The flavor is ice. You were never gonna get that one, were you? Yeah. Okay. It was a good try. Okay. Alright. How does two more sound? And and we'll go ahead and begin another part in the examination, okay? Good. So, this one you're gonna have to let me know, but okay. So it's gonna be a bit of a strong smell, a bit of a strong taste, okay? So here you are. There you go. What do you think about that one? Okay, good. This one was in fact peach. That one was in fact peach. Doing very well. You're doing perfect. Okay, and now we have the last one. Now this last one can be a little tricky. I will admit that. This one can be up for just a small bit of interpretation, okay? So, here is your last one. I'm sure this is probably one of the most entertaining tests / exams that you've had in quite some time, isn't it? I always have a bit of fun of myself with these. So, here you go. And you want another taste? Okay. Here you are. And now, can you please identify that? Hey, you got it right. Congratulations. It is, in fact, avocado. Good job. So tell me, do you like your guac? Good. Alright, so now I'm gonna go ahead and we're gonna come back to these, okay? And what we're gonna do is I'm gonna go ahead and use a swab and just swab a little bit in the back of your mouth, okay? And the reason for this is, remember how I told you earlier that these are up for interpretation when you're smelling it. Well, now I want you to identify it correctly when you're tasting it. Okay? So I'm just gonna go ahead. And use one of these, and I will ask that you go ahead. That you go right ahead for me and open your mouth. I'm just gonna put this right in. We're gonna swab it at the very back. Okay, we're gonna swab it at the very back of your cheeks. And all I need you to do is identify, okay? So go ahead and open for me. There we go. There we go. A little bit here. A little bit on this side as well. There you go. So you will. Please identify those. Or that, I'm sorry. Good, good. It was strawberries. Good going. Okay. Let's see. Let's go ahead and grab this one now. Okay. We just have one more after this, and then I'll let you go, okay? I'm sure you must be in a hurry to do some things, okay? So, here we go. Let's go ahead and grab you a brand new one of these. So, if you will, once again, please go ahead and get ready for this one. This one's a very interesting one, if I do say so. There we go. All right, so here you are. Go ahead and open for me. Good. Let's get a little bit on this side. Good. And a little bit on this side as well. There we are. Okay. So go ahead and let me know how you feel about that one. I know it's a tough one. Good, good. See, that's why the colors don't match. That one was actually flavored orange, but you did a good job. Tangerine will be an acceptable answer. Okay, so here's your next one. Okay. Go ahead and get this right in there. And okay, and here you are. There we go. And a little bit on this side as well. There you go. Okay. Now, if you will, please let me know what you think about that one. Good job. Good job. Good. That will be an acceptable answer. Okay, we're just going to go ahead and write that down. All right. And if you were curious, the flavoring was lettuce. But a vegetable is also an acceptable answer for that. Okay. So, I'm going to go ahead and just say that you have passed this examination without a problem. You did amazing. Without any issues whatsoever. Okay. So I just want to go ahead and say that you were probably just a little stuffy or something. Okay. I do have those cotton swabs that I took from you. I will ask before you do leave that you allow me to just take these two, and I'm just gonna go ahead and ask you to open your mouth. Okay, good. I'm just gonna go ahead and rub these inside of your mouth so we can process these through the lab so we can find out correctly what flavors are, well, not flavors, but what you're exactly allergic to. Okay? All right. So let's go ahead and just get that right here. And now, let's get this one on this side. Good. Here we go. We're just going to go ahead and save these. Perfect. And alright. Alright, so that pretty much takes care of everything for today. I hope that you enjoyed. I hope you enjoyed the examination. Hope you enjoyed the test. Usually these are pretty fun just because you get to taste different things. So I do appreciate you coming to my medical office. I am Dr. Chris, and once again, it was a pleasure having you.